My name is Dr. Adam Farber, and I would like to talk to you today about SLAP lesions. To understand SLAP lesions, you must first understand normal shoulder anatomy. The shoulder is a ball and socket joint where the socket, also known as the glenoid, is part of the shoulder blade, and the ball, also known as the humeral head, is part of the upper arm bone. If the arm bone is removed and you look at the shoulder blade from the side, you can see the circular shaped socket called the glenoid. The glenoid is labeled with the letter G in this image. Surrounding the glenoid is a circular soft tissue structure called the labrum. The labrum acts like a soft tissue bumper that prevents the ball from sliding out of the ball and socket joint. The labrum is depicted with the red circle in this image. The labrum is the main stabilizing structure of the ball and socket joint. The biceps tendon, marked by the green line in this image, attaches onto the top of the labrum. This is a photograph taken at the time of surgery. The socket or glenoid is labeled with the letter G. The soft tissue bumper resting on the edge of the socket is the labrum and is seen here marked by the red line. The biceps tendon attaching onto the labrum is labeled with the letter B. The labrum is often described like a clock face. 12 o'clock is at the top or superior part of the labrum. 3 o'clock is at the front or anterior part of the labrum. 6 o'clock is at the bottom of the labrum. And 9 o'clock is at the back or posterior portion of the labrum. SLAP lesions are tears of the labrum that start at the top or superior part of the labrum at 12 o'clock and extend to the front or anterior part of the labrum at 3 o'clock and also extend to the back or posterior part of the labrum at 9 o'clock. SLAP stands for superior labrum from anterior to posterior. This is a diagram showing a SLAP lesion which is enclosed by the red circle. The labrum is detached from the bony socket at the superior or 12 o'clock position. There are many different types of SLAP lesions as shown in red circles in this image, but they all involve the superior or 12 o'clock portion of the labrum. This is a photograph taken at the time of surgery in a patient with a SLAP lesion. The soft tissue labrum marked by the letter L has been torn away from the socket or glenoid marked by the letter G. The gap between the torn labrum and the socket is enclosed within the red outline. Patients with symptomatic SLAP lesions often report deep-seated shoulder pain. Because the biceps tendon is attached to the superior labrum, this pain may radiate down the front of the arm along the course of the biceps tendon and muscle. Additionally, some patients report symptoms such as catching and painful popping in the shoulder. In older patients, degenerative changes often occur at the superior labrum. Although these may be seen on MRI, they are typically asymptomatic and incidental and rarely require treatment. In younger patients, SLAP lesions often occur after a fall, sudden traction injury, or shoulder dislocation. SLAP lesions are also commonly seen in overhead athletes, especially baseball pitchers, due to repetitive use. These latter two groups of patients often require treatment for the SLAP lesion. SLAP lesions can be either treated conservatively with non-operative measures or with surgery. Conservative measures include rest, anti-inflammatory medications, and a course of physical therapy intended to regain shoulder range of motion and improve strength and mechanics while the labrum heals back to the bone. Surgical treatment involves either repairing the torn labrum back to the bone of the ball and socket joint or cleaning up frayed and loose tissue if a repair is not feasible or necessary. Ultimately, the decision whether to perform a repair or clean-out is made at the time of surgery and depends upon the patient's symptoms, age, and the nature of the tear pattern. Surgery is typically recommended for patients with mechanical symptoms such as catching or painful popping, or those who fail to improve with a course of non-operative treatment. Surgery for SLAP lesions is performed arthroscopically using minimally invasive techniques. Arthroscopic surgery involves numerous small incisions around the shoulder. This is performed on an outpatient basis, meaning that patients do not have to spend an overnight stay in the hospital. The surgery typically takes from 60 to 90 minutes to perform. This is a photograph displaying the setup for arthroscopic shoulder surgery with a small camera device placed inside the shoulder through a small incision on the side, and instruments such as a shaving device placed in the back of the shoulder through a similar small incision. If a SLAP repair is performed, the SLAP lesion is fixed by placing small plastic screws with sutures attached into the bone where the labrum should be attached. The screws, called suture anchors, are seen in this slide before and after they are placed into the bone. Once these screws are placed into the bone, the sutures are then passed around the labrum, and when the sutures are tied together, the labrum is pulled back down to the bone. Typically 2 to 3 suture anchors are required to completely repair a SLAP lesion, but this ultimately depends upon the size of the tear. This image is a photograph taken at the time of surgery showing a completed SLAP repair using 2 suture anchors. If a cleanout is performed, the frayed edges of the labrum are trimmed up, but no anchors are required to repair the labrum. The image on the left is a photograph taken at the time of surgery showing labral fraying, enclosed by the red circle, associated with a SLAP lesion. The image on the right is a photograph taken of the same patient after the labrum has been debrided or cleaned up. For further information about SLAP lesions, please feel free to contact my office at 480-219-3342 or visit my website at phoenixshoulderandknee.com. Thank you.